Hi everyone, I'm Bronwyn Fitz. I'm an integrative gynecologist and functional medicine doctor, and I just wanted to put up a quick video on the elimination diet. So this is for people, if you've never heard about it, you can learn about it, but also this is really specifically supposed to be for my patients to kind of go in depth a little bit more and explain the elimination diet. So there's two main ways I use the elimination diet. One is when we're working with someone and we're really trying to figure out if there's something you're eating that your body is reacting to in a negative way. So we're trying to figure out if you're sensitive to any foods. The other way I use it is to jumpstart weight loss because it's a super clean diet. It really is a good way to start a detox. So a lot of people come to me and they just feel like they haven't been eating the right foods, they haven't been treating themselves the right way, and maybe they have a few extra pounds on, and so they really just kind of want to have a clean slate, clean up their diet, and this is kind of a nice kind of structured way to really help them do that. So, but in terms of trying to figure out if you're sensitive to food, there's kind of two parts to the elimination diet. You're removing certain foods and then specifically adding them back after a period of not having them for a while to see if your body responds. So that's kind of the key thing. So what are the foods we're talking about? The main things, and so you can tailor an elimination diet for anything, okay? But what I'm going to talk about right now is kind of the main general elimination diet I offer to people who have no idea what they might be responding to. So the key things are gluten, dairy, eggs, corn, soy, added sugar, and then those are the sort of the basic ones, and then there's a whole bunch of ones that we add kind of as needed. Peanuts, nuts in general, tree nuts, shellfish, and then for some people we remove all grains. For some people, we remove all legumes. For some people, we remove nightshade vegetables. Those are things like tomatoes, eggplants, potatoes, peppers. So I don't necessarily remove all of those things for everyone, but those are things we might be talking about. So the main idea with the elimination diet is you have to remove all of the food that might be problematic for you, and you have to give yourself a good period of time without any of those potential trigger foods. How much time is enough? At least 3 weeks. 4 weeks is better. I mean, the more time, the better. So if you can give it 6 weeks, that would be even better. But for that sort of experiment, I would say give it 3 to 4 weeks where you haven't had any of those foods. And then your immune system is going to clear out a certain amount of the proteins that are kind of the triggering proteins that your body is responding to that might be causing symptoms. And symptoms vary from person to person. Some people have just obvious gut problems, whether it's bloating or constipation or diarrhea, pain. Some people are really struggling with brain fog, headaches, rashes. You name sleep disturbances, all kinds of things. And so what I do when if you're one of my patients, on the back of that first page of the elimination diet explanation is the symptom diary where you're going to, at the top of the page, when you go to challenge yourself, you're going to write in the food item that you're challenging yourself on, and then you need to take notes over the next few days. And the food diary is key because some of these symptoms are subtle and you forget very quickly how you are feeling. So you really need to sort of do this day by day. So after 3 to 4 weeks of abstaining from all of these trigger foods, you're going to challenge yourself one food group at a time. And it's important that it's just a clean challenge. So when you're challenging yourself for gluten, you can't eat pizza because that has dairy and gluten, right? So it has to be something pure like a bagel or something like that where there's no dairy in it, or just plain pasta. The idea is on your challenge day, you eat a lot of that food, of that one item. Eat a lot of gluten, breakfast, lunch, and dinner, snacks. Then the next, day 2, day 3, day 4, you're no longer eating gluten. Okay, gluten is totally out again. But you're writing down what symptoms you're feeling. And it is tricky because sometimes the symptoms really are delayed. It's not an allergy that we're looking for. It's a sensitivity, and so the immune response is delayed. It is amazing what you can learn when you do this. So after a few days, if you noticed symptoms and then they've now cleared, you're good to go on to the next food item. If you responded to gluten, you got to keep gluten out. We're not going to muddy the waters, so gluten is out of the diet for the rest of the experiment. And then maybe you're going to choose the next food is dairy. And again, you're just going to eat a lot of dairy on your challenge day. No dairy for the next few days, where you're keeping notes and you're tracking your symptoms. And systematically you go through and you add back each of the food items. So you can imagine it takes a while. If you to complete the whole elimination diet experiment, it might take 2 months or more, because you've got 4 weeks with the main elimination and then you're adding back one by one. If you come to a food item and you're not sure, you're like, well, I didn't feel great, but then there was this other thing going on. Maybe I was just coming down with a cold. When in doubt, take the food item out again and revisit it later. Re-challenge it later on, not immediately, but maybe in another 3 weeks. Okay, because you need at least 3 weeks to clear the IgG, which is sort of the immune protein that your immune system makes. So that's the main thing with the elimination diet. Okay, the food diary is very important. Take notes, and even when you're writing, I like people to write and use a number system, like whether it's 1 through 5 or 1 through 10. If it's headaches you're monitoring, don't just put a check mark, because maybe it's a really bad headache, maybe it's not a bad headache. And the more information you give yourself when you go back and you look at the better off you're going to be, and the more meaningful this is going to be. Some people ask me, went to a wedding and I had, this or that, and is that okay? And, the bottom line is, if you do accidentally have one of the food items that you're trying to eliminate, it does muddy the water. It does sort of sabotage the experiment a little bit. So, if you really want to be, a purist about it, you would go back to square one and eliminate the items for, 3 to 4 weeks again. And it's not a guilt thing. I don't ever want people to feel like I'm judging. It's just a matter of really trying to get that clean experiment. And it's an experiment that only you can do. So in some ways, it's really empowering. A lot of people tell me they feel amazing after they've gone on the elimination diet. A lot of people don't want to add certain foods back. They just feel like, I feel great, I'm not going to add these back. That's fine. But if you're really trying to identify what it is that's causing your symptom, I do encourage people to finish the elimination diet and go through all the challenges, because knowledge is power. And if you identify that soy is a problem and gluten is fine, that's amazing, and so you really can, in general, we want as diverse a diet as possible. Gluten's not great for all of us, but if you know that you're okay with dairy or corn or whatever, we want to encourage you to have the fullest, most diverse diet as possible, and to really be specific. If something's bothersome, just take that item out. So that's my sort of brief explanation of the elimination diet. For those of you who are doing the elimination diet to quick jumpstart weight loss or part of a detox program, you don't necessarily need to do the add back phase, although if you've never done it, I would definitely do it. It's really a fabulous learning experience. I put a greater emphasis on no alcohol, no caffeine, some of the other things. I should mention, for everyone on the elimination diet, I always recommend no packaged foods, no processed foods, no fake foods. Try to get organic as much as possible, just because those pesticides are so irritating to our systems. But that's it. That's the elimination diet in a nutshell. And if you are interested in learning more about my practice, please check out my website at Women's Integrative Health. And if you're a patient of mine, I'll see you soon.